line that I gave to the press when they asked what happened in court is that we're winning, but we haven't won yet. And it's really important to keep stressing this. We're going to really need your help to make sure that we use the victory that we've had in court to go on and actually achieve what we want to, which is to keep our services in the NHS. So, Aneurin Bevan, the health minister at the time when the NHS was founded, said that the NHS would exist as long as there were folk with the faith left to fight for it. Just that I really feel incredibly strongly that healthcare for all is a sort of... I can't believe that this is something we even have to discuss.
You know, we know that the private healthcare companies at the moment are saying that our NHS is an unopened pearl of profit to be made. And I think that what this case and the support that we've had so far has shown is that this NHS, you know, it doesn't belong to the NHS managers. It doesn't belong even to political parties or to governments. It belongs to us.
Healthcare does not belong to the marketplace.
So what we faced here in Gloucestershire was they were going to be transferring Stroud Hospital and 9 hospitals across Gloucestershire and 3,000 staff out of the NHS and into an unaccountable social enterprise. In most of the rest of the country, these hospitals, podiatrists, all these services are still being provided within the NHS, and that's what we need to keep here. I've seen the secret options appraisal that KPMG prepared for the Primary Care Trust, which said that actually the main positive benefit for management of moving towards this social enterprise would be that they could cut terms and conditions for staff. And of course that would mean worse care for all of us. And these are all the points that the QC, the barrister, outlined in court. He showed all the ways that these services could have stayed in the NHS had been wrongly ruled out, unlawfully ruled out, and we saw lots of evidence of that in the documents that were disclosed in court. He showed devastatingly how, despite all the talk about how social enterprise was about staff ownership and blah, 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 that actually staff views had been totally ignored. And he showed how leaving the NHS would damage patient care. And he stood up for a whole day and said that in a great deal of detail. It was very impressive to see. And at the end of it, the next day what we expected was that NHS Gloucestershire would come back and defend themselves. And they didn't. What we now face is that the campaign's got to continue. The court case has given us some time. By court order, they've agreed to look for NHS options, but we need to make sure that that's actually what they do.
Can I just say how amazingly unusual it was for the PCT to completely cave in on day 2. They had so fundamentally got the law wrong. If there's one message that you take away with you tonight, it is they do not have to competitively tender for these services. Whatever they do, it is within their own choice, but they can look for these services to remain within the NHS, and there is no need for there to be a competitive tender at all if they can secure a trust within the NHS to take over.
Okay, so just lastly, this was actually inspired by Neil Carmichael, I should say, who sat and told us when we asked him, do you support the right of these services to stay in the NHS? He said, I support the NHS, which is one of those statements that's a bit like, you know, I like flowers or something. So what we've come up with is this pledge, which we're asking everybody to sign.